welcome to another episode of the Leadership Cafe podcast. I'm Sally Mildren, your host, and today we have a really interesting conversation. Our guest, Pauline Hoffman, a data doyen and owner of Beekeeper's Bookshop. We'll get into what that means in a minute if you don't know. Pauline is a PhD, a scholar practitioner, and has a master's and doctoral degrees in communications. She's an associate professor at the Giandoli School of Communication at St. Bonaventure University in New York State. She also is an experienced diver and regularly dives with sharks. She's the author of an amazing, fascinating book, so relevant to today. Yes, Fake News, Witch Hunts, and Conspiracy Theories, an infodemiologist guide to the truth. And that's what we'll be diving into today. And then in her spare time, when she's not the public health fellow and all the other things, she's opening a bookstore. She lives on a farm with her 3 dogs, right? 3 now?
Yes, 3.
5 chickens, a duck, and a hive of bees, which I'll look forward to learning from her. Pauline, thank you for being here with us. I'm excited for our conversation today.
Thank you so much, Sally. I'm thrilled to be here too.
Yeah. So as is tradition in the cafe, we share our mug. Talk data to me.
Yes, I am if nothing if not a nerd. So there's that.
This is a hand-painted mug from a woman artist in Guatemala.
That's lovely. And actually, I should shout out to those nerdy girls. They have a great website and newsletter and things too for all things
I love
nerdy
it.
science.
I love the little sideways glasses.
I know, isn't that
My
fantastic?
brand girl goes whoop.
I know. Uh,
Super cute. So before we dive into the book, you've been a lot of things. You're involved in a lot of things right now. Public health fellow, writing, podcasting, building a business, professor, all the things. We like to take a moment for the audience for you to kind of tell your journey, really. Let's do a quick rundown of your street cred, as you call it in your book. Life is rarely a linear, direct path. And I think it's fascinating to understand how people got to the place that they're at now. What are your highlight reels?
Well, it's my high. Oh my gosh. It's funny you say that because I often have this conversation with my students because they're so afraid at 18, 19, 20 years old that they should have their lives figured out. And I say to them, if you told me when I was a student that this is what I'd be doing today, I would tell you you were crazy.
Right.
So don't ever worry, and I also often say, don't turn opportunities down. I mean, if a door is open, maybe go through that door. You don't have to stay there, but try
Right.
it. You might find you love it. You might hate it, but always try those things. So I wanted to be a marine biologist. That's what my life's goal was. Ever since I was a kid, I have loved sharks my entire life. And
Wow.
I one day on my number one on my bucket list is to dive with the great white shark. I'll be in the cage, not out in the open. And then when I got to college, I still had that love of science, but I've always loved communication and communicating with
Mhm.
people and figuring out why people maybe act as the way they do and how can I craft messaging. And so I was a bio major initially, biology major, and then
Mhm.
I ended up in healthcare. I don't know why or how, and I ended up loving it. Like it's one
Yeah.
of those things. I started working, and then I was in public relations for one of our large healthcare systems outside of, or
Mhm.
in Buffalo, rather. Never did I think that would happen. Then I went back to school, got my master's and PhD, and then became a professor. It's almost like linear, sort of circular. I'm not even really sure. And then the opportunity to become a New York State Public Health Fellow came about. So I've been working with our local health department, and that allowed me to essentially do what I'm teaching, which is fantastic. And then during the pandemic, the World Health Organization, along with our Centers for Disease Control and Prevention, put together a program called an infodemic managers training program, and I jumped in on that, applied,
Right.
and never thought they'd pick me. Why would they pick somebody from rural New York State? I didn't belong to an Ivy League school, or
Yeah.
I wasn't some big time doctor. But that's another thing I'll say to people. Don't you tell yourself no. Let them tell you
Yes.
no. Like always apply and see what happens. And so when I got that, it was really life changing because I'd always been fascinated with conflict and again, why people are communicating, why they believe certain things. And then with the pandemic, it was, holy cow, we have a huge science and health literacy problem in this country.
Yes.
And I realize it's not just here, it's a global phenomenon. So
Mhm.
working with everybody around the globe was phenomenal and fantastic and led to the book. Led to me saying, okay, I don't want to write this as an academic. Academics, we have our own things, right? I want to write this book for the layperson, so it is not written in academic speak. It's very much just like a conversation that we're having right now. So
Mhm.
I injected my sense of humor because I can't not.
Yes. I love that about the book, the little pieces of personality and it make it so approachable too.
Yeah, and that's what I wanted. Like I wanted people to read it and maybe even reach out to me and ask questions or carry on a conversation or ask questions themselves. And then on a lark, I decided, you know what, I'm going to learn to scuba dive so I can get back to my marine biology roots. And so
Mhm.
I've been diving just for the last couple of years, and
Oh.
I'm now at the master diver level. So I've
Mm.
gotten that far, and I have been diving with sharks. So that's
Amazing.
exciting. And I also, along the way, was the dean. And I used to joke with people that actually diving with sharks in the ocean is safer than the sharks I dealt with sometimes in
Yeah,
administration.
that's a very good point.
There's that.
Or in PR, there are plenty of
Oh,
sharks.
for sure.
That is fascinating. I love it. And thanks for sharing that because I couldn't agree more that we say no to ourselves so often and rule ourselves out before we've even knocked and tried or pushed the door and see if it's going to open. And honestly, in my life, there's been a lot of things that should have never worked out that have led to where I'm at today.
And especially women. And since we're recording this Women's
Yes.
History Month, right? It's like
Yes.
women more often than not will look at something, and if they don't check every box,
Mhm.
they will just not do that. Whereas
Yes.
men, on the other hand, they're like, oh, I've met one requirement of the 35, I'm gonna, apply anyway.
Exactly.
And I often say that, especially to my female students, like always apply because no one's going to check every box.
No.
And you don't often know what they're looking for exactly, and you might fit their profile or what they're interested in. So,
Yeah.
yeah, make them tell you no. Don't you tell yourself no.
100%. And I worked my way. I actually started in brain injury therapy, traumatic brain injury therapist, not reimbursable in the US, a conversation for another time. So ended up in marketing for healthcare. And I think it's fascinating when I started, as marketing specialist, worked my way up, got my master's, went to work for a Medicaid managed care health insurance plan. So, been in the health systems and rural care and state systems and hospitals and all that. And now I'm in the health insurance right at the time we were going to roll out the Affordable Care Act. So, for new coverage, expanded Medicaid, new coverage for individuals and families. And it was such a fascinating view. I mean, I wrote a book recently about leadership, and it's almost
Yeah.
entirely built on what I learned there and what you just said about men.
Hmm.
100%. They get these highfalutin jobs that they aren't even necessarily qualified to do, but it's because they just put themselves out there and act the part
And
before
have that
they even know
confidence. I mean,
it. Yeah.
confidence, I'll age myself. I was working at Catholic Health in Buffalo. I was
Mhm.
there, I put its first website together. And I was there when HIPAA became law. And
Oh,
so I helped put together all of
mm.
those materials that, oh my
Wow.
gosh, I look back now and I think that was a million years ago compared to
Yes.
like how communication technologies have changed.
Oh,
And I
totally.
left just as I want to say like Facebook and some of the social media was coming
Yeah.
into play, and I thought, gosh, my goodness, now it's just so different.
It is so different. And I think that's part of why I want to touch on your book today, is because, of course, it was started during COVID, the thinking around it, or what you noticed during COVID. But holy cow, has it never been more true than today? Fake news, witch hunts, and conspiracy theories, regardless of where you land politically, it's so true. I think there's one statement from your intro in the book that says, when the COVID-19 pandemic started, it seemed as though no one knew what was going on nor what to believe.
Mhm.
Theories hung in the air like smog over Beijing. Misinformation and disinformation were rampant, and people couldn't decide fact from fiction.
Yeah.
I feel like that is exactly what's happening in the world today. And
Hmm.
almost being exacerbated by AI, where now we don't know and whether it's intended to be disinformation or not, we don't know what's fact and fiction. And I love you added to that. I assumed people were just stupid and I was wrong. So I want to start there because I can't tell you how many individuals I have conversations with that their conclusion of whatever they're hearing or seeing online or in social or whatever is that people are just stupid. And you shared honestly that you are wrong. Let's start there and kind of talk about what you learned and what was that foundation for the book.
That's my favorite part to talk about, honestly, because it's so easy for us to just label somebody as
Yeah.
stupid or dumb or misguided or whatever it might be. And we have to step back and we have to, first of all, check our own privilege, check our own literacy, and
Right.
check our own ideas and so on too, because sometimes we're wrong, right? I mean, I'm not always right, even when I think that I am. And if you start with the thought that someone is stupid, you're not getting past that. You're not
Right.
going to consider some of the other reasons they may be believing. So
Right.
some reasons people believe, I mean, we all want to feel part of a group, right? So
Right.
if I'm going to try and find somebody who shares my beliefs, whether they're political beliefs or religious beliefs or scientific beliefs, health beliefs, whatever beliefs they are. I want to find that group because that makes me feel part of something. No one wants to
Right.
be the sort of solo person.
Right.
People also are raised with certain values and beliefs, and they hold those to
Mhm.
be very true to them, and there's nothing wrong with that. Whether I agree with them or not doesn't matter. These are their strongly held beliefs. And then also, I do like to talk about the trauma that people may have, and that could be your own personal trauma, it could be cultural trauma, historic trauma. I live in a part of New York State up the street from me. We have a large Native American population. They have a lot of really good reasons not to trust
Yeah.
healthcare, for example, as well as government and other things. If you're African American, you have a lot of good reasons not to trust. I
Yeah.
mean, we as women, Sally, as you know, anytime we have an ailment, we're hysterical. I mean, so we have a
Yes.
lot of good reasons not to trust. And so I think if we start thinking about why people believe the way they do, not saying we have to agree with them, but understanding where they're coming from, that helps us to realize they're not stupid. Just because you don't know what I know doesn't make you stupid. I don't know
Right.
probably what you know doesn't make me stupid. So I think we need to meet people where they are, especially if we're talking about healthcare and communication. I mean, we need to be able to share messages and share the truth in a way that is going to resonate with people. And we can't do that if we assume they're dumb. And we can't do that if we don't know why they believe or where it's coming from or where they're getting their information or who it is they may believe. Maybe it's not you and me. Maybe it's their local minister or priest. Maybe it's the person at the food pantry. Maybe it's a teacher. It could be any number of folks. And I think it's important for us to recognize that. Now, make no mistake, there are days when I'm like, God, you're dumb. Like, I mean, I might be talking to somebody, and I mean, I'm not perfect. I try not to say it, first of all, but then you also have to pay attention to your nonverbal cues, right? Because
Yeah.
I have no poker face. Like, you want to play cards with me because whatever I've got in my hand, you're going to see on my face. So, but just be careful when you're dealing with people, as you know. It's like, but
Yeah.
understanding where they're coming from. There's so much noise out there now, too, I think, that's really
Yes.
clouding the environment. So you have a lot of people who they're trusting people they should be able to trust, for example, like people who are running scientific organizations and medical organizations, and hearing some of the rhetoric too of, okay, you can't trust doctors or you can't trust scientists or you can't trust the media. Pick a witch hunt, literally
Yeah.
here, of who you can't trust. And it does become problematic. And I think too, scientists and healthcare people particularly haven't done themselves as many favors as they could because it sometimes is very difficult to talk to a doctor, for example, because
Yeah.
they don't realize I can't speak to you the way I might speak to my other doctor colleagues at the
Cheers.
American Medical. So you have to make sure that you don't come off as this sort of highfalutin jackass, for lack of a better way of putting it, too, right? So, yeah,
Who's thinking, why are you so stupid?
exactly. Yet here's the guy who's pushing on the pull door at the school for the gifted, right? Like,
Yeah.
they can't, no common sense.
It's funny having worked in healthcare for 20-ish years or so. The echelon of physicians and providers. I worked in higher education. It's
Yeah.
like professors, all the types of doctors. There is a certain level of, okay, we're not all dumb.
Yeah.
You have a very narrow
Oh
niche
my
of
gosh.
brilliancy, and the rest is like, wait, what?
I know. Well, that's why I like to call myself the anti-academic academic because I'll be talking to colleagues and I'll be saying to them, "What the hell? What are you even saying? No one's understanding these words you're using. Like, can you put this in language that makes some sense? Can you use an example that we might relate to?" There's
Yeah.
actually a woman I follow her. I'm not going to remember her name. This is so shameful, but she's a physician and she said during COVID, she put together this great podcast and this newsletter and this Instagram account, and she actually did some communication and PR training so she knew how to talk to people
Good.
beyond her peer group.
Yes.
And I thought, there you go. Like, you recognize that no one's going to understand what the hell you're saying because they don't have that same level of education. And
Right.
that doesn't make them dumb. That just, it's, you need to meet people where they are.
Yes, exactly. I love that. So, principle to your book is the idea of information and disinformation. Let's start with the basics of describe the difference between those two so our audience is with us.
Well, first I'll say I call myself an infodemiologist, and the infodemic is essentially the study of disinformation. So, disinformation and misinformation could be the same piece of information. The difference is intent. So, I might be creating something with some intent in mind. I want to make money, I want some power, I want access, whatever it may be. So, I'm sharing that piece of information knowing it's not true. And maybe you get it, Sally, and you think, Pauline said it, so I trust her, so I'm going to share it with my group. You're sharing misinformation. Same piece of information, perhaps, but it's really the intent. Then now, and this isn't in the book, it'll make it into book two, we have another level that's called malinformation, which is where you're really trying to hurt someone's reputation more than just trying to get power or money. Like you want to bring someone down to a certain point.
So, but this idea of disinformation is not new. I think
No.
sometimes we get a little in a flurry, like, what? It's worse than it's ever been, which in some regards might be, but really it's kind of cyclical, isn't it?
Well, and it's so funny because when I first started learning more about disinformation, I'm like, so you mean propaganda? Because that's what we essentially used to call it,
Yes,
right? And so
right.
now we even hear people saying propaganda, and in my mind, it's all the same thing. Like, it's disinformation. And actually, there are some schools of thought that we should stop calling it disinformation because people are tuning out from it. So I still use it, but I'm like, I might go back to propaganda. We've had disinformation as long as we've been able to lie to each other. I mean, it's this isn't news at all. I would say social media has probably exacerbated it because we're able to communicate so much more effectively, so much more quickly.
Yeah.
Artificial intelligence, I mean, yes, we've always been able to doctor photos or text or whatever, but not the way we can now. I mean, some of these, I even find myself thinking, okay, I got to check this. Is this true? And actually, what's really sad is I find myself doing that with almost everything because
Yeah.
even things 10 years ago that I would have thought clearly not true sometimes turn out to be true, which is even scarier. I see some of the examples now and I think that can't be true. And then it is. And I cringe. I'm like, okay, so I don't even know what to do with that because I would have said that's disinformation and it's not.
You almost wonder if the branding of disinformation is too soft. Propaganda has a little bit more of a provocative edge to the name than disinformation.
Propaganda resonates with me, resonates with you. And I'll have to ask my students because I think disinformation is something that resonates with them. Like propaganda doesn't have the same cachet, I don't
Sure.
think. So I don't know. I mean, it's so interesting. Hey, words, words matter, I guess, right? So,
Yeah, I guess so.
yeah.
And it depends on which generation you're part of. So in the beginning part of the book, there's a conversation around infodemic and that
Mhm.
it's considered a public health
Mhm.
crisis. I wanted to touch on that bit a little. What does that mean and what makes it a health crisis?
So the World Health Organization has called the infodemic a public health crisis. So it's coming from the World Health Organization. And it's a crisis because when you have all of this disinformation out there and you have people believing it, they might not be getting the care they need. And we can look to vaccines as a perfect example. You have so many people Why do we have measles? That's not
I
something we
know.
should be having a conversation about. Why are we talking about polio? Are you serious with me? I mean, these are
Oh,
things that we shouldn't be talking about. And,
mhm.
so we've got these crises because you've got people who are now being told they can't trust vaccines, they cause autism, or they cause this, or this might happen, or whatever it is. And so I think that's a perfect example of how part of the infodemic is a public health crisis. And that's just looking at vaccines. I mean, we could take
Right.
a look at some of the other things I hear from some called wellness influencers really terrify me. Raw milk, eat more red meat. I mean, so many things that can be really dangerous as long as they don't come after my red wine, right? I mean,
Yeah.
I'm kidding. I think they are actually, or
Red wine
coffee,
is
or
still good for you, as far as I know.
in
Yes.
moderation. Everything in moderation is fine. But,
Well, I think,
so you're seeing these things on a global scale too. And those are just things that are, yes, those are global, but certainly US centric. But if you take a look at, other countries around the world too, they have those things that they're being told from a healthcare perspective that are dangerous for them. And then people are believing the disinformation. So that's how it becomes a public health situation.
it's so interesting to me because I worked for Shriners hospitals for almost 8 years, and they were established to treat children with polio. That was their entire mission to start
Yeah.
with. And so in the early 20s, their entire hospitals full with children with polio. And I was in Washington State, which has a lot of anti-vaccine sentiment and thinking. We started to see polio come back after it had been eradicated.
We actually have a gentleman who works at our local health department who had polio when he was a child. Milder case. He had to walk with a cane. He's now in a wheelchair. He's in his 70s. But
Yes.
when the COVID vaccine first came out, we are in a part of New York State that's a very red part of New York, so I'm not living in one of the major cities. And we had a
Yeah.
lot of anti-vaccine sentiment. We still do. And he was so vocal. And especially when polio was making a resurgence, if you will, he was out there saying, you don't want my life. Like, you don't want what I had to struggle through. And luckily,
Yeah.
he's incredibly well respected within the community. So he did have people paying attention to him. But I credit public health as being victims of their own success, right? I mean, we don't know what
Yeah.
polio looks like. I don't know what measles looks. I mean, I do from pictures, but I mean, I've never seen anybody with measles.
Mhm.
So if I didn't have a science background and didn't know all of what's going on, if I was a parent, I'd think, really, does my child need to have this vaccine? Because I
Right.
don't understand maybe what some of the side effects might be, or I'm afraid of those side effects. And is it really worse than getting the disease? So, because we've been so successful, I think that's
Mhm.
kind of been our own downfall too, to a point, sadly.
Well, I think it's across the board. Our agency does work with rural health and with
Mm,
nonprofits. And in your book, you touch on trust and the Edelman trust barometers, all of that. Trust is at a crisis level in healthcare, in part because of what we're talking about today, but also it's the younger generations of consumers and patients trust healthcare less than anybody ever has. The millennial and the Gen Z and Gen A, they don't want just one Western medicine answer. They
right.
want a consideration to the whole. And I think that the concept around trust is so important because, to your point of your book, is how do you know what to trust? What can we look at to even know? When you say, oh, I need to fact check that, where do you look? How do you know how to trust the fact check? Maybe we have a trust crisis as well.
There is no question we have a trust crisis as well. I can share a story if you don't mind. This is actually kind
Yes.
of a funny story. So, my niece lives in Salt Lake City, and I'm here
Mhm.
south of Buffalo, New York, and we are both huge Buffalo Bills fans, right? So, our lives are really depressing because the Bills never get where they need to go. But anyway, that's neither here nor there.
Your quarterback is cute. You've got
He
that.
is. We've got a good team, no question. Anyway, so our mantra is there's always next year. But so we had trouble getting past the Kansas City Chiefs, and there was controversy not this past year, but the year before with the one of the playoff games in the Kansas City Chiefs. And about the refereeing, and it's always the refs, right? It can't
Oh,
be the
yeah.
players, it's always the refs. So my
Yeah.
niece had sent me this. something that she had found. It was like a little paragraph. And she said, "Is this true?" And she knows that I'll do the work and fact check this because this is what I do. So it essentially said, and I'll paraphrase because I won't remember it exactly, that, the NFL is investigating Cleet Blakeman and the other referees about this game, blah, 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 because of some questionable calls, and he's been suspended and all of this stuff, right? My first thought, I read it, really well written. There weren't typos. It looked like it could be from the news, from any news outlet. So the first thing I did was I Googled it. That's usually the first thing I do. I'll Google and see, is there chatter about this? There was nothing. And so then I thought, okay, if this were happening, ESPN would be covering it. So I went to ESPN, nothing. Now, if you know anything about football in Buffalo, like, we are mad about our team. So our entire news outlets would be covering this. Not one of them was covering this. So I finally reached out back to my niece and I said, "Where did you get this?" Which is probably the first question I should have asked. And she said, "Well, I found it on Facebook and now I can't find it." And I'm like, "Well, I wish I'd asked that first. I would have stopped looking." And I said, "I haven't found it anywhere. Like, these are the places that I went that should be covering it, and I didn't see it." And the way she responded was really telling too, because she said, "Oh, I really wanted it to be true." And so I wonder how much we say that too, and particularly in this political climate. And I'm guilty. I'll see a meme or I'll see something and I'll say, "Please be true, please be true," and it's evil. And I shouldn't be thinking that. I don't tell other people which ones I'm
Right.
hoping are true. But, how often do we think that? And is that clouding our thinking? But honestly, when I go to fact check, it's like, okay, who is the source? Like, where's it coming from, first of all? And
Right.
knowing that it came from Facebook, not that Facebook doesn't have things that are truthful, but that would have given me pause.
Yes.
But thinking about where that would be reported, and that's why when you see people ripping apart the media and calling it the fake news, that can be dangerous too, because these are outlets that should be covering these stories. And as someone who works in a department with retired journalists who are training the next generation of journalists, like, I recognize the work that goes into this. And it's not fake news. These are folks who are really out there getting the stories. So then
Right.
is it being covered somewhere where it should be? ESPN and our Buffalo outlets would have been all over a story like that. And it wasn't anywhere. So
Yeah.
think about where these places may be. But then I also worry when people are allegedly or quoting something that isn't true either. I often give an assignment where students have to find a really bad data visualization and talk about why it's bad. And so one person had something that was quoting some data allegedly from the CDC, and I'm like, that doesn't even look right. And he just made it up. Like, he's just like, the CDC said such and such, and it's not even true. But if you put that in there, no one's checking that. They're like, well, the CDC said so. Never mind
Exactly.
that CDC did not. So you really do have to kind of know what you know, but more importantly, know what you don't know, right? So it's like, okay, that doesn't seem to make sense to me. I better double check that. Or I don't know enough about that. I should probably learn something. Or ask the person who does know, like my niece reaching out to me, knowing that I'm going to do the work so she can just sit back and wait for the answer.
Yeah. That's a really great story. First of all, I'm sorry about the Buffalo Bills. My husband is a lifelong Cowboys fan, and
Oh no, Sally.
been
I don't want
almost his lifetime since they've made it anywhere. So we feel your pain. Anyways, I think it's interesting because for our agency, we try to take a science and art approach to messaging, to marketing. And in this neuroscience course at Wharton's executive school that I've been in, they talk a lot about things that we already know, but it's the science and research behind it. As you were talking, I thought of two things. One is, okay, and then once we go, oh, I wish that meme was real, the algorithms are going to continue to feed that same kind of misinformation to you
exactly.
because you had interest in it. And I mean, I can't say it's universally not good, but Threads for me, I could not have it on my phone because once I've looked at one thing, it just took over everything. And there was almost like no way to climb out of this echo chamber of one topic.
Right.
So I had to actually delete Threads off of my phone because it would take me in such a little rabbit hole. And I'd be thinking, this can't be right. And I do the same thing where I'm like, okay, this story about so and so, it's not anywhere else on the news. So I'll stop there and call it
Right.
no. Because if this were real, everybody would be screaming it, theoretically. Depending on which channel you're on, also, I think it matters, which is adding, I think, to the problem. You watch the same story reported on CBS versus ABC versus CNN versus Fox News. It's like the filters on them are very confusing. So it's still hard to know what the truth is.
There are sites. There's one that I usually take a look at. There are others, so this isn't the only one. But Allsides, ALLSIDES,
Okay.
allsides.com, and again, there are others that do this. They will kind of aggregate the news and they'll kind of tell you, okay, the Washington Post is reporting it this way, and it's, left leaning, right leaning. Fox News, right leaning, is reporting
Right.
it this way. And so and these outlets that are sort of in the middle in terms of bias or what have you, or political leaning, are reporting it a certain way. So you can see how the different stories are being reported
Mhm.
in a way that I just find interesting. I just think it's so fascinating how a headline in one newspaper is so different from another, yet it's the same story.
Yeah. Yeah.
Yeah.
Yeah, and honestly, sometimes I'll go to the BBC to get American news because it's like the least bought view, which is
Yeah.
my cynicism showing, but I have a
Well,
trust crisis myself
what's scarier to me are the people who don't get any news. And their news outlet is like whatever someone's posting on Facebook.
on
You know,
Instagram. Yep.
yeah, I have a couple of people in my family who they don't want to watch the news. I mean, I'm a junkie. I read like three different newspapers a day. I'm listening to this, watching this, and because I feel like I have to in order to be able to, well, function. But I was talking to somebody, and this is so awful. I won't tell you who this was because it would be embarrassing for this poor person. But she's like, I was hearing someone talk about, and she was essentially getting to Jeffrey Epstein. And she's like,
Yeah.
apparently he had girls or something. I'm like, how are you not aware of this entire story? This was completely news to her. Sally, this was last week. It wasn't a year ago. And I thought, I guess ignorance is bliss. You have
Yeah.
no idea what's going on. And I think, too, our country especially as well, like we don't travel, right? Like we don't ever leave our little hometowns or our bubbles. So we have no global perspective. And when
Right.
we're told we should just be thinking about ourselves, it doesn't work in a global economy. It's so interesting to me.
That's so
More
good.
people need to dive with sharks.
Yeah, not me. The other thing that I was thinking when we were chatting was, there's a certain function of our brain that doesn't know reality from made up either. So if we really like take this Facebook post, we
Yeah.
can make that misinformation something that we truly deeply believe.
Yeah.
And our brain doesn't know the difference. So then it will start to kind of influence our choices and our decisions and our behavior, and to me that is why I think your book is so important in these times, is to give people permission to stop and ask a couple questions before just swallowing, before taking the bait and swallowing.
That's what I would really love people to do. I don't even care what the question is. If you are
Yeah.
someone who's, maybe anti-vaccine, okay, fine. Please ask the questions.
Yeah.
We can help you get the information or whatever it is. I just use that as an
Yeah.
example.
Yeah.
Ask the question. Don't just accept everything people say to you necessarily if you're not sure. Now, there are
Right.
certain people that I do trust, and of course, having a certain background, like certain things, right? But
Right.
I don't know everything. We're renovating this house that we're going to turn into the bookstore, and I'm coming up against topics I don't know anything about. I don't know how to wire a house. So I'm asking questions, and of course, the people probably think I'm stupid, right? But I'm like, just because I don't know what you know, but make me understand it. I'm giving you money, I need to understand it. So I have
Right.
no problem with that.
So, in pulling this kind of back to our audience, is a lot of marketing, communications, business owners,
Yes.
people who, really, in a way, especially in healthcare, we have the role of trying to help debunk some of these myths or the false narratives that are existing. What are some thoughts that you have about the importance of their role, or things that they can or shouldn't do, or I don't know, from your perspective, where's that role of communication and why is it so important?
It's incredibly important, right? Because we're the ones getting the message out about, whatever program we're offering, whatever information people need to have in order to stay healthy and to stay safe and so on. I would say you're not going to have just one message. I mean, you may have one event you're planning or one crisis or whatever you've got to get information out, but it's going to vary. You've got to really know your audience. Never
Yes.
before, I think, has it been more important for you to understand who it is you're talking to and
Right.
realize that you might have maybe one message, but you're going to have to deliver it in 35 different ways. I mean, I hope
Right.
it's not that many, but it could be.
Yeah.
But then also, don't just think about you doing it by yourself. Think about the people you have in the community who have also developed and established trust with your audience and have them help you craft and communicate those messages. I mean, heck, if you have the bandwidth, have some of the folks who you're trying to reach help you craft the message. You know what I mean? Because
Hmm.
then they own it too. So I
Yeah.
think that there is not going to be one answer. I am
Right.
not a fan of censoring and boycotting and going online and saying, don't believe this. You need to educate people how to
Right.
recognize this and how to be critical thinkers. And I think that you need to establish yourself as that trusted resource. If the
Hmm.
first time someone hears from you is during a crisis, too bad, forget it. You
Yeah.
don't have them. I mean, they
Yeah.
need to be able to look to you to get the accurate information. And so
Hmm.
there isn't one easy answer, but it's just constantly being out there and communicating and knowing your audience and
Yeah.
knowing who it is they believe and who they trust and knowing what those messages are
Yeah.
that are going to resonate with them. So it's
Sure.
pretty much marketing communication 101,
Yeah.
but combating the disinformation and thinking about the channels too. Like, are they on Facebook? Like, for us, we
Hmm.
don't really do a lot with anything but Facebook because that's where everybody is. And they also still like their local newspaper.
Right.
So that's some place to go. Whereas
Hmm.
if you're in a more urban area, maybe you need to reach out to some of the bloggers or, other folks,
Hmm.
who knows. But don't discount those opinion leaders, those people that really can help you push the needle and get things
Right.
to happen because they can
Sure.
be great ambassadors for sure. But no,
That's
my
good.
gosh, know your audience. You have
Yeah.
to know your audience.
Yeah. Well, so let's talk about a rural town and measles. Let's walk through who you would reach out to.
I'm gonna lock myself away in my house. No, honestly. Okay, so we actually have, like, the gentleman I just mentioned who had polio growing up. He's become
Yeah.
an incredible ambassador for us because he's
Hmm.
incredibly trusted. So when he comes out and says, "Look, if I had," and I know it's not measles, but it's still a vaccine that he can say, "Look, if I had had the opportunity to have that vaccine, this is how my life would have been different." And
Yeah.
I think here too, for us in a rural community, I would reach out to perhaps the schools to make sure that
Hmm.
teachers are getting the education out. Other parent groups, if there's like a PTA or if there's a Head Start programs, those are people that you
Yeah.
trust. Daycares, some of our local, we have some really great nonprofits that work very closely
Hmm.
with younger families and things like this. Our WIC programs, so there are a lot of different outlets that we could get out to get the information out or to at least answer questions, right? Like,
Right.
hey, are you vaccinated? Are you considering that? Certainly pediatricians, right? We want to reach out to them.
Right.
We also have near us a large Amish population. And so
Hmm.
we have a couple of nurses who have spent years, because none of this is happening in a day. They've spent years developing relationships with the Amish
Right.
community. And so
Right.
they trust these nurses. God help us when those nurses retire. Like, I really hope there's some kind of succession planning
Right.
because that takes so long, especially for communities like that too, right? It's really very much reaching out, making sure people understand. Now, you're still not going to get everybody, right? And trying to do that is just going to waste resources that you probably don't have. So, those people that you
Hmm.
can impact, I would say reaching out in all of these different channels is going to
Hmm.
be probably your best bet. And I know people listening to this or watching this are going to say, yeah, great, we don't have the people to do that. We don't have the money to do that because we're in rural communities. They're cutting our funding, all of
Hmm.
these things. We didn't have it before, now we have it even less.
Yeah.
But once you start that ball rolling or get the dominoes falling,
Hmm.
I think that it becomes a bit more helpful and just every resource you can get.
Yeah, I think it's so wise what you shared because, When I think back to the rollout of the expanded Medicaid, for instance, uh, it like 38% more people were eligible for coverage under
Mhm.
expansion in Washington state, and they didn't know it. And so, in a way, we were starting without having had the runway of years of relationship. And I always come back to this concept of the antidote to distrust is relationship. And trust, once you've built it, is your most prevailing brand asset that you will ever have,
Exactly.
particularly in the realm of health. I think of the rural health transformation money that has just been released to all 50 states for rural health to transform. A lot of it is based around care, improving, specific long-term care kinds of outcomes, but there's a big portion of the money that is geared toward community engagement and
Hmm.
health communications and all of that. And I always come back to this idea that there is no transformation
Yeah.
without that transfer of information. And so the idea of line upon line, one group after another for our outreach for the Affordable Care Act and the expanded Medicaid, for certain populations, we went to their international stores.
Right,
We were at
right.
a table outside of the Latin market, or we were at certain hairdressers. We did a congregational health
Hmm.
initiative where we met with specific congregational leaders and faith leaders in the community to be able to help give them tools to help their audience. And I think that's back to your point, it's really at the end of the day marketing 101, but I think we get so in our own chamber that we forget the basics.
Well, and interestingly too, if I could piggyback on that, because I find it interesting because you're answering to somebody, rarely is the person in marketing like the
Right,
CEO. So you
right.
have to sell this too. And I find so often that they want you to do something that goes viral, right? Like something has to be
Right.
on social media that's like the ice bucket challenge or
Yeah.
whatever it is. And it's like that's not realistic. Let's think about again who our audience is, where they are. Like that's not what we can sell. So you're not just selling this to your audience. Like part of your audience is probably the people who have to approve it.
Yeah.
I also have found in rural health, and I'm sure this isn't just in rural health care, we find a lot of people who don't realize that they're eligible, as you mentioned, for some of these programs. So our message is also, or there's that stigma. So,
Yes.
for example, our WIC program, we know how many more people are eligible for the program than are taking advantage of it. And we suspect that some of that is they don't want people to know that they have this need or whatever it may
Yeah.
be. I mean, we have the RAM, Rural Medical Clinic. I'm forgetting what the A stands for, but anyway, every year it comes into town and there are lines of people, especially for dental, because of course dental's
Hmm.
what we're missing a lot of times in rural areas.
Yes.
And these are folks too who don't realize that they're eligible for X, Y, or Z service. And so it's these
Yeah.
opportunities allow us to remind them of that. We do a lot of stuff at our county fair, believe it or not. Like we're at the
Yeah,
county
we
fair
did
because
too.
that's where people are.
We did
And
too.
yeah, and they don't know all the services that we have. So
The
anywhere you
county
can
fair
go
is a
where you can,
dream.
what'd you say?
Get your fair princesses talking about your medical message. That's a
Exactly. Like
dream in
whoever it
rural.
is, like come on, yeah. Oh,
Where's our fair princess? Come on.
I know our Dairy Queen or whatever the heck they're called. I know, right?
Oh, I love that. And honestly, some of the most transformative, impactful campaigns that I've led in my career came from connections exactly like that. The
Exactly.
local AAA baseball team, or, things that are truly part of the community that people have an established trust with are really the way in.
But then you also have to have your in too, right? Like if I just showed, it'd be so weird. I don't have children. If I showed up at one of the Little League games, they'd be like, who's this crazy stalker woman? I mean, so
Yeah.
you need to have that relationship. I'd have to
Yeah.
find someone like you to go and sell chips or whatever they do. And this seems daunting, and it is. Like, none of this is easy. If it was easy, we wouldn't be having this conversation. We'd have no
Right,
trouble.
right.
And, so many partnerships. There are so many grant opportunities out there. And the other thing I find too, we're trying to develop in our area this sort of nonprofit networking because there are so many
Mhm.
nonprofits and we're probably working at cross purposes. So, how can we figure out that we don't need to do that and maybe we can shift some things around and figure out who's doing what. So
Yeah.
there's some of those initiatives. Certainly we have our healthcare programs within our own my own university that
Yeah.
work within the rural area too. Like, there are so many partnerships and things that you can take
Yes.
advantage of.
And honestly, I am 100% in the belief system that in these times when geopolitical pressures, the political narrative, the funding, federal government funding that's stopped to nonprofits, all of the things, the economic pressures that are influencing rural health and nonprofits.
Right.
I totally believe that the way forward is truly these communities that are doing what you've just said, bringing together the partners that are already committed to making a difference in the community. Do we need three food kitchens in our town, or could we do with one and pull our
Right.
resources and work in partnership with these other organizations to make a difference? I love that kind of work. That's part of what we have dreams of being able to help establish as an agency, because I feel like when we can connect and pull on the same rope, we're going to so much more powerfully fulfill our mission than everybody needing to have their own branded rope.
It's making those connections too. Like, how
Yeah.
can I participate? How can I help? What can
Yeah.
we do within the community? And it's funny, I think it was Pew Research did a study
Mhm.
fairly recently that people are relying on, like, they may not trust the national media outlets, but they trust their local media and they trust those in the community because these are your neighbors. These are people you see. So, regardless of your politics or your religion or whatever it may be that is a dividing line, these are people you see, you
Right.
trust them regardless.
Right.
So I think that's important to think about too.
I know we could talk for hours.
We
I'm
could.
so grateful for you joining us. Maybe we'll have you back. I know you're working on book two.
I
What's the
am.
thought? What of when that's going to be ready?
Yeah, I'm supposed to write it this month and it should be coming out in, I think, early fall. I
Okay.
think it might actually be, now that I've said that, it might be early next year, but I'll be
Okay.
talking about it all summer and all fall because I can't shut up about things like this. So
Oh, good.
I'll keep you
Well,
in the loop.
maybe
You'll
we'll
hear
have you
about it on
back.
LinkedIn, that's for sure.
We'll have you back for another episode and talk about it, because I just think it's so important to not
I'd love
just
it.
do our job, but to remain aware of our influence in society, in our organizations, in our
Yes,
communities. As communicators, it's very powerful.
it is. It's so important.
Thank you very much for joining us. And listener, thank you for joining us as well. If you liked what you heard, leave a comment or follow us on Apple, Spotify, or the YouTube. And I'm Sally Mildren, your host. We'll have a link to Pauline's bookstore, to her LinkedIn, to her book where you can get it. It's super fascinating. I highly recommend it. And if you want more information about the Leadership Cafe, we're at theleadershipcafe.com. Thank you.